I want to jump to what I know is one of your top pet peeves is exaggerated networks. And I'm just going to turn it over to you with no setup because this is your bag.
So this is a very interesting paradigm, and I've spent years watching this. And for all of I think as consumers, we sort of understand, but also from the health plans who are on the phone, having come out of a health plan, and I am extremely protective of our health plan roots, and ensuring that we had an excellent network. But there are consistently across the country challenges with health plan directories in terms of accuracy and challenges with ensuring whether or not providers are accepting new patients, et cetera. This challenge and sort of the need to increase access created a new sort of class of provider organizations that are like very large aggregators. And they were created to sort of help increase access to in-network clinicians, also helps sort of take away some of like the back office work for independent clinicians. But what I'm seeing happening is sort of like a new trend where a lot of the sort of initial challenges that lived within a health plan directory now have sort of just like morphed over into this other world, where we're getting pitched with organizations that say they have like 20,000, 50,000. I even heard an organization said they had 80,000 providers across the country. And at first glance, you'd think like, why not? Of course, I would want to add that number of providers to like give my members the best possible chance of increasing access. But in reality, the sheer volume is not actually solving the clinical challenges, back to like that first slide that we talked about. The other piece of this that's very interesting, and I would urge all of the health plans on the phone, what we have found after sort of additional due diligence of many of these different organizations is that in many cases, the same provider actually works for multiple organizations at the same time. So you're like sometimes double or triple counting your network, and it doesn't actually give the reality of what's being sort of marketed. So that has been interesting for us to watch over the course of time. The other piece that we also have sort of seen, which is a different sort of paradigm, are individual providers who work for these like very large, or sometimes multiple very large aggregators, who also then independently have a private practice that's out of network. And that also creates an extensive amount of confusion for the member, because it's like, did I see you through this aggregator or this one or this one? Or are you going to bill my insurance as an out-of-network provider, which is, exponentially more expensive than the in-network benefit? So that reality has also created some additional challenge and confusion. And lastly, back to sort of the whole point around the need for evidence-based practices, what we find often in the pitch that we hear from giant organizations is that they can take care of basically any condition. And I would urge my health plan colleagues on the call to just sort of dig a little bit deeper. Back to your point, Joe, around supporting members with serious mental illness and substance use disorder, there are very specific documented evidence-based practices for those conditions that actually will get somebody better. And, going to a generalist who's not going to, give you medication-assisted treatment for your substance use disorder and not take care of you in the way that is clinically valid is not actually care. It's just utilization. So this is part of the need, which to just ask additional questions and think about not only the numbers game, but whether or not that access in volume is going to deliver the clinical results that you and your members need.
Yeah, it's for you sports fans out there, I would say the difference between a coach and a clinician is, Bush League baseball versus major leagues. And when it comes to taking care of members, we like to focus on credentialed experts, clinicians who have the right training, skills, and evidence-based approaches.